As a heart surgeon who has spent decades treating older adults, I'm going to tell you something that may shock you, but it could save your life. Every week, I see seniors who walk into my office feeling exhausted, short of breath, dizzy, or just not quite right. And more often than not, the problem isn't aging, diet, or stress. It's the medication they've been taking every single day, medications they were told were safe. Some of these pills are so common you probably have them in your medicine cabinet right now. You might have even taken one this morning. But here's the terrifying truth. Millions of older Americans are unknowingly taking drugs that are damaging their hearts, and in some cases slowly destroying them. And these pills aren't rare or experimental. They're FDA approved, widely prescribed, and often recommended by well-meaning doctors who may not fully understand how dangerous they can be to an aging heart. In this video, I'm going to reveal 7 everyday pills that could be silently weakening your heart without you even knowing it. Pill number 1 is the most dangerous of all. Don't stop watching. This is about your heart, your health, and possibly your life. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Pill 1. Anticholinergic medications, often used for overactive bladder. If you're over 60 and taking medication for bladder control, I need you to listen closely. Pills like oxybutynone and tolterodine, commonly prescribed for overactive bladder, may seem like a simple solution to a bothersome problem. But what you're not being told is that these pills can quietly damage your heart and slowly destroy your brain. These drugs belong to a class called anticholinergics, and while they may reduce urgency or accidents, they come at a heavy cost, one that your aging body may not be able to afford. Anticholinergic medications block a neurotransmitter called acetylcholine, which plays a vital role in keeping your nervous system, brain, and even your heart functioning properly. As we age, our bodies become more sensitive to these kinds of disruptions. When you take these pills regularly, especially without frequent medical supervision, you may begin to feel tired, confused, dizzy, or worse, experience a rapid or irregular heartbeat. These are not just side effects. They are early warnings that your heart may be under attack. Recent studies show that long-term use of anticholinergics in seniors is linked to a significantly higher risk of dementia and cardiovascular complications. What's most alarming is that these symptoms often creep in slowly. You might think your memory loss, lightheadedness, or slower walking pace is just part of getting older, but it could be a pill you're taking every day, a pill that's quietly damaging your heart muscle and increasing your risk of sudden cardiac events. These medications can also raise your heart rate unnaturally and interfere with how your heart responds to physical stress. For an older adult whose cardiovascular system is already more fragile, that can mean the difference between living independently and a sudden trip to the ER. Some patients even experience heart rhythm disorders without realizing what's causing them. And doctors don't always catch it because these pills are often overlooked. Imagine trying to prevent a bladder accident only to slowly lose your mental clarity and weaken your heart in the process. It's not worth the risk. That's why I'm urging you, if you're using any bladder control medications and you're over 60, speak to your doctor about safer alternatives. There are gentler options, and many newer treatments do not carry the same heart risks. You owe it to yourself to stay sharp, strong, and heart healthy. Because up next is a pill that's even more common, and it's hiding in plain sight in medicine cabinets across the country. And unlike this one, it can begin destroying your heart within just weeks. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Pill 2, corticosteroids like prednisone. If you are a senior taking corticosteroids like prednisone, especially for conditions like arthritis, asthma, or autoimmune disease, this is a warning you cannot afford to ignore. These pills are often handed out like candy, prescribed for weeks, months, even years, without fully explaining what they can do to your aging heart. And while they reduce inflammation and ease pain in the short term, the long-term price you pay can be devastating. These medications are slowly damaging your heart, and in many cases, they are destroying it from the inside out. Prednisone and similar corticosteroids work by suppressing the immune system and reducing inflammation. But over time, they also raise your blood pressure, increase blood sugar levels, cause fluid retention, and lead to significant muscle loss. These effects are especially dangerous in older adults, whose bodies are already more vulnerable to changes in pressure and circulation. Imagine your heart trying to pump harder every day while your blood becomes heavier, your blood vessels tighter, and your body more swollen. That strain doesn't just wear you down, it wears your heart out. One of the most silent and frightening effects of long-term corticosteroid use is congestive heart failure. You may start noticing swelling in your feet or ankles. You may feel winded after walking up the stairs, or suddenly unable to catch your breath at night. These are not small inconveniences. These are red flags that your heart is failing to keep up. And too often, these symptoms are dismissed as aging when they are in fact caused by the very pill that was supposed to help you feel better. What's more alarming is how corticosteroids also weaken the heart muscle itself, increasing your risk of heart attack, even if you've never had heart disease before. Your heart can't fight back the way it did in your younger years. Every day on these pills, especially at high doses or without proper monitoring, is like adding bricks to a load your heart is struggling to carry. You deserve to feel better without sacrificing your life expectancy. If you've been on corticosteroids for more than a couple of weeks, please speak to your doctor. Ask if there are safer treatments or if your dose can be reduced. The damage is often silent until it isn't. You don't want to wait for your heart to give out to realize something was wrong all along. Because next, we're talking about a pill that many seniors take for something as common as heartburn. Yet, it may be silently weakening your heartbeat and leaving your heart defenseless. And the worst part? You've probably been told it's completely safe. Pill 3. Certain heartburn medications, H2 blockers, e.g. ranitidine, famotidine. If you've been taking heartburn medication for years, pills like ranitidine or famotidine, believing they're harmless, I need you to reconsider. These medications, known as H2 blockers, are commonly used by seniors across America to ease acid reflux and indigestion. They're available at every pharmacy over the counter and often taken without a second thought. But what you're not being told is this: these pills can quietly be damaging your heart, and in some cases, slowly destroying it. As we age, our bodies rely more heavily on nutrient absorption to maintain balance. H2 blockers reduce stomach acid, not just the acid that causes heartburn, but also the acid required to properly absorb magnesium and vitamin B12. These are not just nutrients, they're essential for heart rhythm regulation, muscle function, and oxygen delivery to the heart. When you become deficient, the consequences are serious and too often overlooked. Seniors who use H2 blockers long-term can develop dangerously low magnesium levels. This isn't just about fatigue or leg cramps. Low magnesium can cause irregular heartbeats, palpitations, and even sudden cardiac arrest. And because symptoms build up slowly, most seniors don't realize what's happening until it's too late. You might think the dizziness or skipped heartbeat is just part of aging, But in reality, your heart is struggling to maintain its rhythm without the support it needs. It's fighting a battle you're not aware of. And that little heartburn pill you trust each night might be silently undermining its strength. In addition, H2 blockers can disrupt the balance of good bacteria in your gut, leading to chronic inflammation, a known contributor to atherosclerosis and heart disease. For older adults, chronic low-grade inflammation is one of the greatest long-term threats to heart health, and it rarely causes pain until a crisis hits. You were told this pill was safe, but safe for whom? Not for a senior heart, not for someone who's already managing blood pressure, cholesterol, or diabetes. The truth is, if you're over 60 and taking these medications regularly, your heart may already be showing early signs of stress, and the damage may have begun long before any diagnosis appears. Please, ask your doctor if your heartburn can be managed differently. There are safer strategies, lifestyle changes, dietary shifts, and even other medications that don't rob your body of what it needs to protect your heart. Don't wait until an EKG shows damage to start asking questions. Because up next is something even more terrifying. A simple cold medicine found in almost every American household that can raise your blood pressure in just hours and put your heart at immediate risk. And chances are, you've already taken it this year. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. Pill 4, over-the-counter, cold medicines with cough suppressants. If you're over 60 and reach for a cold or flu medicine when you're feeling under the weather, you're not alone. Most seniors do. It's second nature, especially in winter, to grab something off the pharmacy shelf to quiet a cough or clear a stuffy nose. But what you may not realize is that many of those harmless, over-the-counter cold medications contain ingredients that may be damaging your heart, and in some cases, actively destroying it. One of the most dangerous culprits is dextromethorphan, a cough suppressant found in nearly every cold product labeled DM. While it may quiet your cough, it does something far more dangerous under the surface. It slows down your central nervous system, and when mixed with certain medications commonly prescribed to seniors, such as antidepressants, sleep aids, or blood pressure drugs, it can create a toxic storm inside your body. You might feel groggy, dizzy, or anxious. But those are not just mild side effects, they could be signs your heart is struggling. Dextromethorphan can also trigger a condition called serotonin syndrome, especially when taken with SSRIs or SNRIs, which are common in older adults managing depression or anxiety. This syndrome can raise your heart rate, cause irregular rhythms, and even send you into cardiac distress. Most seniors don't suspect a cough syrup could be the cause of a rapid pounding heartbeat, but it can be. And it doesn't stop there. These cold medicines often include phenylephrine or pseudoephedrine, decongestants that constrict blood vessels. That means less oxygen and blood flow to your heart and a sudden spike in blood pressure, something no aging heart should have to handle. You might notice your heart racing after taking them. That's not your imagination. That's your heart trying to cope with stress it shouldn't be under. These drugs are marketed as safe, quick fixes. But for older adults, especially those with any history of high blood pressure, heart rhythm disorders, or heart failure, they are anything but safe. They are a hidden threat in every medicine cabinet, and they're taken far too casually, without anyone warning you that they could be quietly destroying your heart, one dose at a time. Please, before you reach for another cold or cough pill, talk to your doctor or pharmacist. There are safer ways to ease symptoms that won't compromise your heart. And if you've already experienced fast heartbeat, dizziness, or chest pressure after cold medicine, that's your warning. And it's one you cannot afford to ignore. Because next, we're about to talk about something even more alarming, a pill taken by millions of older adults every night in search of rest. But instead of helping, it may be silently weakening your heart, your lungs, and even your brain. You won't want to miss what's coming next. Pill 5, sleeping pills, sedative hypnotics. If you're over 60 and struggle with sleep, you're not alone. Many seniors lie awake at night, battling restless thoughts, pain, or simply the silence that seems louder with age. It's understandable to want relief, and that's why millions of older adults turn to sleeping pills like Zolpidem, Ambien, or older sedatives like diazepam, Valium. But what you may not know is that these pills, while promising rest, may be quietly damaging your heart and slowly destroying it night after night. Sedative hypnotics work by slowing your brain and nervous system. While that may help you drift off, it also suppresses your body's natural signals, including the ones that keep your heart in rhythm and your breathing steady. These drugs can weaken your body's ability to respond to low oxygen levels during sleep, leading to or worsening sleep apnea, a condition where breathing repeatedly stops and starts. And every time that happens, your heart is starved of oxygen and pushed into distress. This silent damage builds up over time, increasing your risk of irregular heartbeat, high blood pressure, and sudden cardiac events. You may think these risks don't apply to you because you've taken these pills for years, but that's exactly why you're at greater danger. The longer you stay on them, the more they accumulate in your system, especially as your liver and kidneys slow down with age. What once felt like a harmless aid can turn into a dangerous sedative that interferes with your heart medications, disrupts your brain chemistry, and leaves your cardiovascular system vulnerable. And let's not forget the falls. These medications cause balance problems, confusion, and dizziness, making nighttime trips to the bathroom a minefield. A fall may seem unrelated to your heart, but one broken hip or internal bleed can quickly send you into a spiral of hospitalization, immobility, and heart failure. It's all connected. Most heartbreaking of all, these pills don't even fix the root cause of poor sleep. They mask it. And while they do, they're stealing your alertness, weakening your body, and leaving your heart exposed to damage that may never fully heal. Is it worth the risk? If you're taking a sleeping pill every night, especially without reevaluation, it's time to speak with your doctor. There are safer strategies: behavioral sleep therapies, melatonin in controlled doses, and adjustments to your routine that can help you sleep without slowly harming your heart. And now, we need to talk about a class of medications that were once considered standard for mood and pain, but for seniors, they've become a silent cardiac threat with deadly consequences. You'll want to hear this before you fill your next prescription. Pill 6, Tricyclic Antidepressants, the forgotten danger. If you're a senior who's been prescribed medication for depression, anxiety, or even chronic nerve pain, there's a strong chance your doctor may have placed you on an older class of drugs called tricyclic antidepressants, like amitriptyline or nortriptyline. These medications have been around for decades, and though they once helped many patients, for those over 60, they now represent a hidden threat. What most doctors don't say clearly enough is that these pills could be silently damaging your heart, and in some cases, slowly destroying it without a single warning sign. As we age, our heart's electrical system becomes more fragile. Tricyclic antidepressants interfere with that system by blocking the very nerve signals that help your heart beat in a steady, coordinated rhythm. For younger people, the body may compensate, but for seniors, especially those with a slow heartbeat or a history of arrhythmia, this interference can be deadly. These drugs can trigger heart block, cause blood pressure to swing dangerously low, or even lead to sudden cardiac arrest. You may feel faint, dizzy, or experience a flutter in your chest. These aren't harmless side effects. They're red flags that your heart is under attack. Worse still, these medications are often prescribed for more than just mood disorders. Some doctors use them for migraines, neuropathy, or insomnia, often without monitoring cardiac effects. And because symptoms can be subtle, like fatigue or shortness of breath, they're often dismissed as just getting older. But in reality, your heart may be paying the ultimate price for a medication that should have been replaced years ago. These drugs often increase your risk of falling. They cause sedation, blurred vision, and confusion, making them especially dangerous at night or when combined with other medications. And a fall in your 70s or 80s is not a minor event. It can lead to hospitalization, surgery, or a chain reaction that puts your heart under even greater strain. Every fall, every moment of disorientation increases the load on a cardiovascular system that may already be struggling. What's most tragic is that safer, newer antidepressants exist today, medications that don't carry the same cardiac risks and are better tolerated by older adults. If you're still on a tricyclic, not because it's the best option, but because it's what you've always been on, it's time to question that. Your heart deserves better. Your life depends on it. Because next, we'll discuss a medication that's still widely prescribed for high blood pressure and chest pain, but for many seniors, it's become one of the most dangerous drugs in the cabinet, quietly pushing the heart past its breaking point. And chances are, your doctor never warned you. Pill 7. Calcium channel blockers, the silent strain on the aging heart. If you're a senior taking medication for high blood pressure, chest pain, or an irregular heartbeat, chances are you've been prescribed something called a calcium channel blocker, drugs like verapamil or diltiazem. On paper, these medications seem like the perfect solution. They relax your blood vessels, lower blood pressure, and reduce strain on the heart. But for people over 60, these very same pills can become a hidden danger, silently damaging your heart and, over time, destroying it from the inside out. The aging heart doesn't bounce back like it once did. It slows, stiffens, and becomes more sensitive to changes in rhythm and pressure. Calcium channel blockers, especially the older ones, can reduce your heart rate too much, leaving you feeling exhausted, dizzy, or faint. You may think you're just slowing down with age, but in reality, your heart may be struggling to keep up, barely pumping enough blood to support your brain and vital organs. What's worse, these medications can cause fluid retention, leading to swelling in your legs, shortness of breath, and increased risk of congestive heart failure. They can also interact negatively with other medications you may be taking, like beta blockers, diuretics, or blood thinners, creating a dangerous cocktail that slowly wears down your cardiovascular system. This isn't just about feeling tired, it's about your heart working overtime every hour of every day against the very medication meant to help it. And too often, the signs are overlooked. You may feel a little more tired in the morning, find it harder to catch your breath, or feel your pulse slow to a crawl. But these red flags get blamed on aging, not the drug in your cabinet. By the time the problem is identified, the damage to your heart muscle may already be irreversible. That's why, if you've been on a calcium channel blocker for years, especially without regular monitoring, it's time to ask your doctor, is this still the best option for me? Newer alternatives may exist, and your heart deserves the safest, most effective support available. You should never settle for a medication that makes you feel older, weaker, or more fragile than you really are. Because what I'm about to tell you next could be the most important part of this entire message. A truth I've learned from decades in the operating room, watching seniors suffer not from disease, but from the silent damage caused by medications they were told were safe. And it all leads to one final life-changing takeaway you cannot afford to miss. The pills you trust may be silently taking years off your life. After decades as a heart surgeon, I can tell you this. Most of the seniors I've seen hospitalized didn't end up there because of a new illness, but because of old medications taken for too long with too little oversight. These aren't rare or experimental drugs. They're pills many of you trust every single day. Pain relievers, sleep aids, reflux pills, antidepressants, blood pressure medications. But what you don't feel today can still be damaging your heart, wearing it down slowly, quietly, and sometimes permanently. You deserve better than that. You deserve clarity, not confusion, strength, not slow decline, and you deserve to ask hard questions without fear. Don't stop your medications on your own, but don't stay silent either. Talk to your doctor. Bring a list. Start the conversation that could protect your heart and extend your life, because no pill is worth taking if it's quietly destroying your future. Your heart isn't just a muscle. It's your story, your strength, and your second chance. Treat it like it matters, because it does. And if this message helped you, don't keep it to yourself. Someone you love may need it even more than you do. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.